Hello guys, today we will start talking about urology, and first topic is injury and disease of the genital organs. All what you need, just listen, hearing. Yeah, I will. No, you will listen. Yeah, I will talking. That's all. Okay. Before we start talking about urology disease, we need to know 4 urological syndromes. First syndromes, it's a renal colic. Renal colic is a pain in place where renal. It's the first one. Acute urinary retention. It's a syndrome when patient haven't got a chance to take all urine away from urine bladder. Patient have some urine, but he can't take it away from urine bladder. Hematuria, it is blood in urine, and anuria when patient have problem with urine, problem with kidney, for example, when he can't do urine. If we talk about acute urinary retention, we understand that the problem is in urine bladder or in urethra. But when we talk about anuria, we need to understand that it's a problem in the kidney or in the kidney. Renal colic. The reason, etiology of renal colic, it's urolithiasis, pyelonephritis, nephrosis, tuberculosis of the kidneys, tumors, compressions of the ureters from the outside, nephritis, urethral, nephritis, and injuries. Clinical picture. Patient will feel pain, urination, burning sensation in the urethra, nausea, abdominal distension, constipation, and no gases. Diagnostics: ultrasound, X-ray, and urinalysis, where we need see blood or maybe leukocytes or another cells. Urology treatment. When we talk about treatment of pain of colica, we need to understand that we need to give to patient non-steroidal anti-inflammatory drugs, and if they don't help, we need to give him some narcotic, some drugs, and maybe some another treatment, some another drugs to help patient. When we talk about colic, kidney colic, we need to understand that it's often it's a problem of lithiasis disease, nephrolithiasis disease, and when stone go away from kidney, he will damage organs, and it lead to pain. Okay. And how and when we talk about colica, we talk often we talk about nephrolithiasis and how we can help patient. We need give him painkillers, and we need give him we need say him that he need go to bathroom, take a hot water and lay down there. When he lay down in bathroom, all his muscles will relax, and it can help to take away a stone. And we need say to the patient that he need to drink more water. AUR, acute urinary retention. It's when patient can go to the toilet and can't do free a urinary bladder. Etiology: disease of the genital urinary system. Two types. Yeah? It's a disease of genital urinary systems and disease not related to the pathology of the genital urinary system. Disease of the genitourinary systems. It is a prostate adenoma, a bladder tumor, urethral stones, urethral strictures, paraphimosis, and urethral injuries. When we talk about prostate, we need to understand that prostate will compress an urethra, and then patient can't do a free urinary bladder. Bladder tumor 2 will compress urethra. Urethral stones 2 will compress urethra. Strictures will compress urethra, and paraphimosis will compress urethra. And urethral injuries will compress urethral. You need to understand that the most often it's a pathology of urethra. And disease was not related to the pathology of the genitourinary system. It's, for example, fecal stones, disease of the central nervous system, patients after childbirth, after operation on the abdominal organs. Clinical picture: pain, bulge, patient. When we see a patient, they will say us that they feeling growing pains. We will see under the pubium a tumor, something like tumor, something big. When we do a percussion, we will feel a stupid voice, volume, sound, stupid sound. And during treatment, it is necessary to first determine the causes of the delay. Okay, treatment. With pathology of the genitourinary system, immediately proceed to catheterization of the bladder. If catheterization does not work, then a puncture of the bladder is performed. Hematuria. This is a presence of blood in the urine. Hematuria can be mini and macrohematuria. When we talk about microhematuria, we understand that color of the urina will change, and we can find some blood just under microscopic examination. Macrohematuria is another name, gross hematuria, and another name, macrohematuria, is determined by change in the color of the urine. We see it. Etiology: trauma, tumors, stones, inflammation of the genitourinary system. And the next it's anuria. Anuria is stopping the excretion of urine by the kidneys or stopping its entry into the bladder. 4 forms. Prerenal, renal, subrenal, and reflex. Prerenal, which occurs when there is insufficient blood flow to the kidneys, for example, thrombosis, embolism, inferior vena cava, renal vessels, shock. Acute heart failure, acute blood loss. Renal resulting from damage to the renal parenchyma in glomerulonephritis, intoxication, poisoning with poisons, subrenal caused by a violation of the tumor. Very interesting. Oliguria. At the beginning of the disease, there may be oliguria, a decrease in the amount of urine. Clinical picture: weakness, headache, lack of appetite, nausea and vomiting, jaundice of the skin, swelling on the face, shortness of breath, heart arrhythmia, convulsions, loss of consciousness. Treatment: bladder catheterization, introduction of laxatives and antispasmodics. That's all. Injuries of the organs of genitourinary systems. Kidney damage. It can be open and closed kidney damage. They are divided once closed according to the type of damage. They are divided into bruises of the kidneys, ruptures for the renal parenchyma, crushing of the kidney damage. Types: injuries of the kidney, ruptures of the renal parenchyma, crushing of the kidney, damage to the vascular pedicle. Open damage. And there we talk about gunshot. I think that many patients wasn't correctly and something not. I don't feel for him something good. No. Okay, gunshot. Close damage. Pain in the lumbar region, swelling of the renal area, hematuria. Причины закрытых повреждений почек. Diagnostics. Gymnastics. X-ray, ultrasound, inspection, blood and urinary test, hemodynamics. Damage of the bladder. We can see extraperitoneal and intraperitoneal damage. When all of these can have pain, urinary retention, urge, and hematuria. Extraperitoneal injuries. delayed from the earliest picture that optional the presence of urinary infiltration in the crotch area. Percussion is defined by a dual sound over a pubs without clear baranders. Interperitoneal injuries. There we afraid peritonitis. If gynecologist finds something here, we can do a peritonitis. Diagnostics. Bladder catheterization to understand what the kind of urina we have. Radiograph cystography and ultrasound examination. When we talk about bladder injuries, all of this situation will need treated only surgery. Remember about epicystostomy. A prerequisite for the complete of the operation for extraperitoneal rupture of the bladder is the removal of urine from the bladder through an epicystostomy and drainage of the peritoneal space. Damage of urethra is characterized by the release of blood from the urethra, urinary retention complete of partial pronounced perineal hematoma. If the victim partially retains urination, it is accompanied by sharp pain in the urethra, perineum, and then intermittent stream. First aid. Kill pain, painkillers, apply cold to the perineal area, and suspensorius to be hospitalized in the urology. Catheterization of the bladder is strictly prohibited. You can harm for patient. Don't do it or be very careful. Diagnostics. Radiography. We see contrast in the organism, yeah, but we don't see something about messy. Light damage of the urethra. Bruised mucosal rupture, incomplete rupture of the urethral wall. Treatment. Conservative treatment, catheterization, bed rest, painkillers, hemostatics, antibiotics. Surgical intervention. If the condition of the victim deteriorates sharply, then surgical treatment is performed, suturing of the urethra or its plastic surgery. Foreign bodies of the urethra and bladder. Enter the urethra and bladder through the external opening of the urethra in. Patients with mental illness, young children during day, during masturbation, attempts to induce an abortion, rarely with medical manipulations. Foreign body. Small foreign bodies can cause difficulty urinating change in the yet. Resist and blood at the end of the act of urination. Larger foreign bodies give a picture of acute urinary retention, hematuria, to urine without urinary pain. Complications. First of all, it is suppurations and suppuration formation of urinary fistula necrosis of the cavernous body of the penis. Diagnostics: ureteroscopy and cystoscopy. Treatment: use cystoscope. Foreign bodies are removed through the urethra using a cystoscope. Only in unsuccessful attempts, surgical intervention is used as suprapubic section of the bladder. And that's all. This is a good film if you want to watch it, to see it. And thank you very much. Have a nice day. See you later.